As this slide says, well, once the patient is charged, even with the charitable hospital, you lose that legally, but it's not necessary that way. It is a defensible practice. But as a surgeon, as a clinician, you need not feel that the picture is so bad. It can stay within the limits, up to date, audit, and effective. Where the accountability of the hospital is also important, the direct liability and in vicarious liability. I think everybody is aware that even if your staff does something, even my experience, I cannot say that my biometrics technician has done that wrong. So you are responsible for that. So consent is not more than consent. You have got the risk and complication, alternative treatments are available. And the informed consent is so important. I think I should say that language of the patient, it should be explained to that, and the discussion witness from each side. And so failure to obtain could lead to you medical negligence. So disclose the likely expense. This is very important. That's the sore point. Many times patients file case that whatever I was told, but the package was told 20,000. Though you have a VR, some maybe a nucleus drop, you pay it from your pocket to the VR surgeons, or else if like a PPC or a very hard cataract, you can tell the patients, well, if you nucleus drops, you'll be charged 20,000 more. The report is smiling at that. Most of the time, I tell that if that is so. So this has to be explained to the patient. Now, if a normal case, if you do and you charge the patient 20,000 and tell the VR surgeon, no, you can't get anything to it, that's not there. You can share it. That's my advice. Written acknowledgement, failure to pay, documentation again is very important, medical records, appropriate entries, and capital letters. Overemphasized from standard abbreviation, discharge summary, write in full form, medical records should be patient's complete name, it should the act performed, reason why you are performing this, no inconsistencies in different medical records, circle around inconsistent remarks. So these are the things which are taken over by the lawyers later on. See, you have written there. And patients, and again, this is the high risk concern. I think the VR surgeons would be aware.
Yes, Anaka.
By the patient or the patient attendant, let them look at. I think I have got 3 minutes now. So integral part of medical practice is audit and see improve your practice, respond constructively to reviews, assessment, and if you're a part of a hospital management, if you're a junior there, see that whatever assessment is done, you respond to it. Communication, again, very important. The doctor should be given an option to change the doctor midway doing whenever he is getting around. So we have the right to seek second opinion. And this is what I have learned. I may not speak to the patient too much, but I have been over my 25-year practice a good listener, because just a small incident. One of my junior surgeon patient came to me yesterday that he is a very proficient surgeon. He's a very good surgeon. I know he came with all the reports to me. Why? The reason was the doctor didn't listen to me. And why? No, he was always busy in his computer. I mean, he was recording whatever you are talking. See, eye-to-eye contact was not there. And whatever you were saying, he was writing it down or noting it for a good one. No, I don't think he listened to me, whatever my complaint was. And so this is in this age of EMR, most of us are sitting in the computer and whatever patient we're trying to save us medically, but this is one thing which can go wrong. And administration, everything, see, administration should be there ready with the clinical backup, the clinical correspondence, acting appropriately. And the hospital should provide you safety for the patient, cleanliness, sanitation, fire control, training and motivation. So last but not the least, how to reduce risk. Invest time in communication, risk and benefit escape with the patient. Do not change the records. And you should have a legal cell. If you're a big hospital, definitely there will be a legal advisor, hospital professional, general liability insurance is definitely an alternate dispute resolution policy. This has to be there in a hospital. We have it. One of our senior Dr. Bakshi is our red dressel forum. Many patients we just send. So it can be extrajudicial. You can just, if you have it, it avoids costly and lengthy legal procedures. So when the complication happens, discuss with the event, explain why you believed it happened, and acknowledge how the patient and family must feel, not how you feel. I mean, that is where it comes. Develop a good communication, rapport with the patient. Focus on what can be done. If complication was due to medical error, have a plan to compensate the patient. So last but not the least is the empathy, the power of compassion. That will actually, we have to look within ourselves, how we can protect ourselves. Once it happens, there are many ways, but then if we do it from if the patient feels that you are with the patient, if they have empathize with the patient, to look at this legal problem, but in spite of that, things might come. Thank you, Shumana, for bearing with me, for bearing with my
All right.